The ultimate use of the whole entire infrastructure and system is really to create learning health systems. Systems that are able to compare different types of interventions, whether they're pharmacological or behavioral, and translate the benefits of that research into real, clinical practice. That's the ultimate end game here. LPHI is a nonprofit 401c3, operates in New Orleans and has reach across the area of across Louisiana. Does a number of things from public health programs to clinical informatics.
We truly cherish the relationship that we have with LPHI because this actually gets us into the next generation of patient engagement and next generation of clinical integration to integrating clinical and research ecosystems for learning health systems.
Persistent is very much involved in creating the tools that allow for the data aggregation and then the data aggregation to pump in to the app suite, which is the patient engagement mechanism, to be able to enroll patients efficiently, into these trials. It's essentially patient 1, 2, 3, 4, 5, 6 at Ochsner, patient 7, 8, 9, 10, 11, 12 at Tulane. The personal protected health information stays at those sites. They send us the UPCs. We link that patient record, essentially becoming patient A, across multiple sites without sharing that protected health information. So we're able to maintain our data as a limited data set, but still link patient records across multiple systems.
It's also very exciting for the fact that we can now integrate a lot of these sensor data to start mining the overall global public health landscape, right, and integrate IoT also in the product ecosystem.
We look forward to working with Persistent related to the population health analytics, the movement of patients throughout a healthcare system and not a healthcare facility, and then also leveraging sensory data from inside houses, embedded inside patients, worn alongside patients, to collect these mass amounts of data of the Internet of Things, link it to clinical records, link it to research records, and then be able to have an ecosystem that is flexible enough to be able to receive data from these multiple sources and test research hypotheses, but then find actionable clinical interventions that save lives.